So, welcome back to the TRT and Hormone Optimization YouTube channel. And back with us is Dr. Rudolf Eberwein. Welcome back, Rudy.
Thank you so much, Stephen. Always a pleasure. And I love the way you say my name. That's a true European. Eberwein.
I read recently that the FDA have some new regulations concerning compounded drugs, and that's also compounded testosterone formulations. So, you, as an expert in a TRT clinic, so tell us more about it.
Yeah, so there's a lot to unpack on this because there's a few different parts of this that I want to go over. And I sent you an article about this that they had circulating, and then we're going to go over this. So first part is that the FDA is saying that um, since the pandemic, they had lifted the regulation that patient needed to be evaluated in person at the doctor's clinic to be able to be prescribed testosterone. Because of the pandemic, they lifted those laws because they allowed a telehealth consultation, no in person visit, to be able to be prescribed controlled medication because testosterone is Schedule 3 medication. You know, the FDA in the US, they are scheduled medications, meaning that you need a DEA license to be able to write those prescriptions. And there are 1 to 4. Schedule 1 would be drugs that they feel have no use in no medical benefits, things like heroin. And Schedule 5 will be the lowest. Testosterone is considered a Schedule 3. So before the pandemic, a patient, if they needed testosterone, had to go see a doctor face to face to be able to be prescribed testosterone. With the pandemic, they lifted those laws. It wasn't just done for testosterone, it was done for any controlled substance. So they were able to, now clinics like us or any provider was able to prescribe testosterone without having to do a face to face visit. And that has been very helpful because, we've talked here a lot about this, even the epidemic of low T that is happening in our society. And it's not just in the first world like the US and Europe and Canada, it's happening globally. So patients have a lot of difficult accessing providers to give them the right care when they experience low testosterone. So because of this, um, um, with the pandemic era, patients were able to access clinics and be able to get their care easier. So now, since the pandemic emergency has passed, so Congress in the United States is saying that they may repeal that law, that they're going to go back to pre-pandemic laws where a patient has to go do an in-person visit to be able to be prescribed controlled substance, meaning testosterone also.
Mhm.
So let me unpack a few things here. First, let's go over why testosterone was ever put in the schedule list as a controlled substance. That was done in 1990, and that was under it was the Anabolic Steroid Control Act in 1990. And I found out about that the other day. I spoke to and I became friend with one of the preeminent lawyers that talks about steroid law, defends steroid bodybuilders and people who use steroids. And Rick Collins is an amazing guy, and I encourage your viewers to go to his page on Instagram. He talks a lot about this. So why testosterone was put as an illegal controlled substance in 1990? It's after the Olympics, where Ben Johnson, the Canadian runner, was able to outrun every American runner and got the gold medal. And they found out after that that he was using testosterone, performance enhancing drugs. And the Senate was so mad about this that they passed a law that they said that testosterone now should be a controlled substance. It
Mhm.
was not because testosterone was dangerous. It was because testosterone gave unfair advantage at a sporting competition. And because of the testosterone was put in the controlled substance and made it so much more difficult for patients that needed testosterone to access it.
Yeah.
Mind you, back in 1990, there was not that many guys on testosterone. Loti was not that much of an effect of a problem back then. What we've seen over the last 20, 30 years has been a true explosion of Loti clinics. And there's a lot of controversy about this. Conventional medicine will tell you that we're seeing all of those low T clinics and all this increase in testosterone prescription because of advertising. I go the opposite way. Low-T clinics have come in to answer a need that patients were feeling tired, they were feeling depressed, they had low sex drive, erectile functions. They would go to their primary care doctor and they couldn't do anything from them. They would go to their urologist and they couldn't do anything for them. So Low-T clinics have stepped in to help patients who are having that problem to find a good treatment as a root cause for their problems. Because now I'm going to go to the second part of the issue. So first, they put testosterone as a controlled substance, not because it was dangerous, but because they deemed it a performance enhancing drug. Number two, what they're saying is that testosterone should be prescribed accordingly and the right way based on guidelines. And I agree with this to a certain point. So there are two different guidelines to be prescribed testosterone in the United States. You have first the American Urological Association that says that you can only prescribe testosterone. Is testosterone checked twice, at least 2 times, is below the threshold of 300.
Yeah.
Endocrine Society says that the prescribed testosterone should be prescribed if testosterone is 2 times below the lower limit of normal. So those are not contradictory. They don't say the same thing because now the lower limit of normal for the new LabCorp and Quest has become 264 and upper limit to 916. So you have two different guidelines that they want us to follow that don't say the same thing. First, the one from the American Urological Association, the 300 should be less than 300. This was an arbitrary number. And this has been discussed many times. When they were discussing that, they asked the urologist that came up with this number, they're like, how did you come up with 300? Was it something that was a number that the study showed us? It's like, no, we just took 300 because it was an easy number to remember. So an arbitrary number. So they want us now to follow that arbitrary number. Number two, now the Endocrine Society now says it has to be lower than the normal. The new normal is 264. So I had a patient like this the other day. He came to me. He was 38 years old. His testosterone total was 278. So he falls between those two guidelines. If I follow the urological guidelines, it's below 300. It's okay to give him testosterone. If I follow the endocrine guidelines, it's above 264. They would not allow me to give him testosterone. And in none of those guidelines do they take symptoms into consideration. Actually, I had an interview with Dr. Ramasamy, who's a prominent urologist at the University of Miami, and we reviewed the latest guidelines at the Urological Center. At least they added symptoms to be considered when you're seeing a patient.
Of course.
So it's starting to get to this point. I've always said that endocrinology to me is one of the most difficult specialties because endocrinology should not be a number-centered diagnosis. It was never before. Endocrinology, meaning when it is your hormones that affect our body system, the way we used to treat it before we have tests to measure testosterone level, thyroid hormones, it's you saw a patient, you take a history, you do a physical exam, and you come up with the differential diagnosis. Once you have a differential diagnosis, you didn't have numbers at that time, you try the hormone as a therapeutic trial. So let me give you an example. A patient would come to me and complaints of being fatigued, tired, depressed, low mood, decreased erections, decreased sex drive. My differential diagnosis would be, okay, this could be low testosterone, this could be thyroid, this could be depression. What are we going to do with this patient? Let's say I don't have blood tests on this patient. My first thing would be, more differential diagnosis. I would try to see, do they suffer from constipation? Do they have dry skin? That would point me more towards a thyroid issue. And before we had blood tests, they would give a thyroid therapeutic trial if the patient responds, and you keep treating them like this. If you feel that it was more testosterone, you do a testosterone therapeutic trial. If the patient responds clinically, you keep going like this. Now, what we're seeing is when a patient goes to a doctor with those typical symptoms, tired, low energy, low sex drive, the differential diagnosis remains the same. But now if you do a blood test and the testosterone is not less than 264, depression remains the most important part of the differential diagnosis. And a lot of those patients will receive a prescription for an antidepressant, an SSRI. And
Yeah.
I'm so against that because SSRIs have been shown to be dangerous long term. They can increase risk of diabetes. There was a study that showed after 10 years it changes brain structural changes. So it's easy for a doctor to see a patient with those symptoms, put them in an antidepressant that we know is not the root cause of the issue, and may have long-term side effects, instead of trying something that now has been, like testosterone, that has been shown to be safe. So to me, this is a real problem that we're dealing with. Um, as a physician, I'm still able to use testosterone in an off label, meaning that even if the level is not below that number, if I feel clinically that the symptom has those, I document and I tell the patient we're going to use this on an off label use and we're allowed to use it. If they take that away from us physicians, that would be horrible because they're trying to make us do cookbook medicine, which does not work.
Yeah.
And we can talk about another subject talking about this. The concerns that Congress has, what they are saying on their paper, is that testosterone is being prescribed inappropriately, and there's increased risk of heart disease because of testosterone. Well, we got a new trial that completely took that away. You know, testosterone, there's always been the controversy. Does testosterone replacement therapy increase the risk of heart disease? There's always been a big question mark. Studies have always been showing that it is more on the positive side, that testosterone replacement therapy, when done properly, actually decreases your risk of heart disease. But back in 2013, there were two studies, Vengel and Finkel, Vegan and Finkel, that showed that there was a slightly higher risk of heart disease in some testosterone patients, in some patients receiving testosterone replacement. So the FDA put a black box warning against testosterone with adverse cardiovascular events. They looked at those two studies. They were very poorly done. And, you know, we have a preeminent urologist, Dr. Morgenthaler, out of Harvard, who did a whole series talking about how poorly done those studies were. And they sent a lot of letters against those studies, and most of those studies were retracted. But the black box warning stayed with the FDA. So now there's a new trial that came out. It's called the Traverse trial. And that was amazing. They took about 5,200 men. Those men were between the age of 45 and 80, and those men had higher risk or already pre-existing cardiovascular disease. They put them on testosterone gel, and they followed them, I think, for a total of 22 months and another follow-up of 30 plus months. So that was a good study where they followed patients. It was 5,000 men, and they saw that even in those in that older population of men with high risk for heart disease, with pre-existing cardiovascular disease, when you put them on testosterone replacement, there was not an increase in heart disease. So now we can put that to rest. Testosterone replacement therapy, when done properly, does not increase the risk of heart disease. So now let's go back to Congress trying to take away our ability to prescribe testosterone, right? They put it on the scheduled list because it was a performance enhancement, not because it was dangerous. We should know better. Number two, now they're saying risk of heart disease. Now we have the Traverse trial to let us know that this risk is not there. So they were supposed to make those changes happen in May. They push it back for November. So we're waiting to see what's going to happen in November. You know, the way I used to practice before that happened, patients used to fly and see me in Miami, establish a patient-doctor relationship, do a face-to-face visit, then we could continue with telemedicine. So to me, the worst that could happen is that they take that away from us. Patients will just have to fly in and go see a provider to get this. But one thing that we know is not going to go down, the demand for good medicine is never going to go away. And that why I say good medicine, because I'm not just a testosterone doctor. I'm a doctor, I'm a functional medicine physician who tries to help their patients feel better. Whether we need to have testosterone, thyroid, the right supplements, the right nutrition. You know, that's what we do, Stephen. You know this. It's not just about testosterone. It is helping patients feel better. And I'm going to tell you, Western medicine is failing patients on the preventive side. We're really good at helping patients when they're sick care medicine. You know, I used to work in the hospital, in the ICU, in the emergency room. We're great at this. If you have an emergency, you come to the United States, we are amazing at this, but we are not good at root cause medicine, at preventive medicine. And doctors like myself, all the organizations I go, like AMMG, A4M, the Institute of Functional Medicine, they are training the new physicians to pay more attention to the root cause and to prevention. And hormone health remains a cornerstone of preventive medicine, right?
Awesome.
And now I'm going to go now to what we've always talked. Why
Yeah.
are we seeing so much hormone disturbance in our society? Why are we seeing that back in 1990, there were very few men who needed testosterone? 30 years later, you see so many men who need it. It is the toxic world that we live in. It is the endocrine disrupting chemicals that we're seeing. Our food has become even more harmful to our health. All the toxins. Right now, I don't know if you've seen that in the United States, there's a class of chemical called the PFAS, PFAS,
Yeah.
per and polyfluoroalkyl substances. Those are horrible chemicals. They are mostly done, those chemicals, you find them in firefighting foams, flame retardants that they put in your clothes. They put it in the Teflon non-sticks. They put in a lot in skincare products to make it smoother. Those are chemicals that are neurotoxic, immunotoxic, and endocrine disruptors. They've been shown to have so many bad effects on our health. And they did a study now. They found high levels of those PFAS in 45% in the drinking water in the US. It's in 97% of the blood of Americans. 97%. It's everywhere. So we don't even know what those chemicals can do to us. We're just starting to study them. There are more than 10,000 of those chemicals. So we know that. Why are we seeing that testosterone has dropped so much over the last 30 years? Why has sperm count dropped 52% over the last 40 years? And every time they check it, they see that it's getting worse because the chemicals are so much in our system. So our hormonal system is being overwhelmed by those ubiquitous chemicals that are so harmful to us. But conventional medicine is lagging behind. We're still doing our differential diagnosis based on what we studied back in the 1980s and 1990s. We need an update. We need to know that the world we're living in now is a different world. And the complaints, when I see a patient come to me and tell me, Doc, I'm tired. My drive is not the same. I feel like I feel blah. My sex drive is not good. My energy. One patient told me that great, and I loved it. He told me my chi energy, my life force, mon élan vital, it's not there anymore. What gives you this? It's testosterone. If you have low testosterone, you feel old and grumpy, whatever age you are. And not only do you feel old and grumpy, it affects your health. When I see another passion of mine lately is talking about male infertility. I don't know if you knew that, but 1 out of 3 couples trying to conceive are having issues now. And out of those, 50% is coming from the male side. Male infertility is unrecognized as a part of the global infertility crisis that we're seeing. We used to think 30 years ago, if there's infertility in a couple, it's the woman. Now it's 50% part of the male because sperm count has decreased so much. And you know that a low sperm count is a harbinger for poor health in men. So now when I see my patients in their 20s and 30s, I always do a sperm count, a sperm analysis, because we have a company now that can do a sperm analysis at home. You don't need to go to the lab anymore and have to get your sample in the back bathroom. You can be at home and they send you a sample directly. You should see the amount of abnormal sperm samples I'm seeing in my 20 and 30-year-old guys. So when I say that, first, it is mind crushing for a man to see that his swimmers are not working properly and that he may not be able to have kids. That is mind soul crushing to a man. So, but there's so much technology now that most likely that couple can get pregnant, whether they do IUI, IVF, you take HCG. There's a lot of things that can be done, but it stays in the man's mind that, my God, my sperm wasn't good. Am I a man? What's going on? Your masculinity feels like it's being attacked. And now, even if you have your kid, having low sperm count has been shown to be a marker for poor health, increased risk of diabetes, metabolic syndrome, heart disease, stroke, low T, ED, all of those things. So if we don't talk to those men and let them know Those are the things you're facing. And all we want to do with those men is tell them it's in their head or give them an antidepressant. We're doing the wrong thing.
Yeah.
And thank God we have clinics, practitioners, associations that are becoming stronger, doing functional medicine, root cause medicine, out of which testosterone is a big tool.
Yeah. Thanks for explaining. Check out my TRT workout split or the ebook The Ultimate Guide to TRT Cream. Links to the merchandise shop in the description.